We will also send you an evaluation form for today's program. So please complete. We value your feedback and consider signing up to join our education registry. I would also like to introduce our speaker, Dr. Seth Gale. Dr. Gale is a behavioral neurologist at Brigham and Women's Hospital, an instructor of neurology at Harvard Medical School. His research interest is in lifestyle and non-pharmacologic interventions, including the use of mobile health and other technologies to promote brain health and reduce the risk of dementia and cognitive decline. Dr. Gale is also interested in clinical ethics, philosophy of medicine, and the optimization of cognitive assessment in clinical practice. He works as an investigator on multiple studies in Alzheimer's disease at the Center for Alzheimer Research and Treatment at BWH. Dr. Gale, just excuse me just a second. Sorry. Dr. Gale graduated from the Medical College of Virginia, completed a neurology residency at Tufts Medical Center, and a behavioral neurology and neuropsychiatry fellowship at Brigham and Women's Hospital. Now I'm turning it over to Dr. Gale, who will give a brief overview of the Roadmap to Prevention presentation and answer your questions.
Thank you, Nancy and Ilana. Can I get a thumbs up that my audio is okay? Always good to check in. Okay, perfect. I can see a number of people. Thank you for the introduction. I thought I would start actually by saying, I'm going to say a couple of things about brain health and about what was in the Roadmap to Prevention pamphlet, and also there was a video. But my main goal here is to create a space after I talk for a couple minutes where people can ask questions. And to me, that's hopefully will be the most kind of beneficial way for you to get something out of this. So hopefully you'll be thinking of maybe some questions to ask, and we'll have some space to kind of for me to answer them. So what I'm going to do is I'm going to just kind of walk through some of the main points from the prevention packet that was handed out. The main topic here is brain health, and brain health we think about with both normal cognitive aging. So as we all get older, there are normal and expected changes with our thinking and our memory that happen even in the most healthy of circumstances. And brain health also applies to behaviors and interventions that we can do if we have memory impairment. So if people have cognitive difficulties or the beginning of something like Alzheimer's disease, there are things that people can do to reduce the risk of decline. So that's kind of like the broad topic. About normal cognitive aging. So as I said, there are changes that we all have, and we know this from long-term studies of people every decade from 40s, 50s, 60s and on, where there is a change, there is a decrement in certain mental functions that we observe. And this, it doesn't mean, and there's certainly a lot of evidence that it doesn't mean that people can't be very mentally sharp and contribute to their fields if they're working, to write, to read through their 90s, through their hundreds. It's just what I'm describing is just that there are changes that we expect with aging, and there are ways to try to make that curve of decline a little bit less steep. So if you imagine that we're all like this at our cognitive prime, and as we age, there is a slow change. And the idea is to try to make that slope of decline, that rate of decline, as not sharp as possible, meaning to try to change that curve. So I thought I would mention this point that's in the packet about normal changes that we have with aging, normal memory changes, and then when memory loss is concerning. So this is a very natural, common question in this topic. And even when people come into their internist office or a neurologist office, which is what I'm experiencing day to day normal for age or not? And sometimes, so it's hard to distinguish between those two things sometimes, and that makes sense. Someone can be having frequent episodes of forgetfulness, and it doesn't have any indication of a problem, and sometimes it can. And what we try to rely on, of course, in a medical setting, we rely on doing certain memory tests, asking certain questions, talking to family members to try to determine if there's a problem. But generally, what I'm trying to say with this point is that giving yourself a break about senior moments and changes is the best way to operate. And also eliciting feedback from people who know you best and being open about it and talking about it is the most helpful way to understand if there's a problem or not. There's some examples in the packet about how if I'm forgetting names more frequently, having trouble switching from one subject to another in conversation, requiring more time and effort to learn new information. Those are all changes that are typical and normal for aging. So if you think, as you heard those, if you think about examples in your everyday life where you're experiencing those things, unless the frequency is significant, it's starting to interfere with your abilities for daily functioning, etc., then this is generally not something to worry about. Okay, and then the last piece here describes 7 major steps that we can all do to reduce the risk of dementia. Alzheimer's disease, and we can talk more about this if people are interested. Alzheimer's disease is the most common form of dementia. There are many other different types of dementia, but the one that we think about most commonly is what we know to be Alzheimer's disease. And these are some behaviors that reduce the risk for all of us of Alzheimer's disease. And these are important regardless of family history. There are people who have a family history of dementia or Alzheimer's disease. There are people who don't. These are important, no matter what, because we can all actually improve or change the rate of our decline with cognition with these behaviors. So they fall into a couple of categories that are not rocket science, but are worth reviewing. So eating a healthy diet, a Mediterranean style diet, or there's another acronym we use that's called the MIND diet, MIND, which we can talk a little bit more about if people are interested. It's kind of a variation. That's a guideline that's important to do. Exercising frequently. So aerobic exercise where your heart rate gets up a little bit and you're a little bit out of breath is an indication of what we call aerobic or cardiovascular exercise. Number 3, staying socially active and mentally fit. So keeping the brain active with various different activities. And it's a really common question, should I do this or that for normal cognitive aging, knitting or audiobooks or reading or community activities. So we don't from all the research, there's no way to say that this activity is better than that activity, okay? But what we do know is that when you follow people over time, 10, 15, 20 years, and you collect information about the types of activities that they did during this time, when you look at all of those, they all matter. So all of these, what we could describe as socially and mentally stimulating activities in aggregate together are protective against decline. And and you'll see if you look at the packet that was sent out, there's a bunch of different descriptions of some of these activities. I just mentioned some of them. I think one of the keys, or one of the under kind of missed gems in that description is in that category is social activity. So we think about keeping the brain active with puzzles and reading and Sudoku and card games and that sort of thing. But actually challenging the brain socially in new and challenging social situations, like joining coming to a course like this and interacting socially. Finding a group of people to have a regular interaction with, like card games or tea or coffee, those are all social activities. So step fourth step, building cognitive reserve. Cognitive reserve is a concept we use that combines a bunch of good activities like I've described, and also reduces activities that are bad for the brain, like unmanaged stress and anxiety, untreated mood changes or depression, having poor nutrition, and sleep habits or sleep behaviors that are poor. Those things detract or take away from the brain's ability to resist the changes with normal aging. So we're going to have changes when we get older with thinking and memory. We want to do everything we can to try to reduce the amount of decline that we're going to have over time. Okay. Step 5, develop healthy sleep habits, something that we can also talk about and come back to. There's an idea called sleep hygiene that people may have heard about, which is basically having doing the types of behaviors in a routine way as part of your routine for getting ready for bed and going to sleep, that get your body and brain in the state in which you'll have restful and restorative sleep. So, for example, some of the obvious ones are removing electronic devices right, in your bedroom or right before you go to bed, like TVs, smartphones, stimulating the brain right before you're about to retire to sleep. Making sure your bedroom is a comfortable temperature for you, dark, not a lot of ambient light, and relaxing. Okay, these are all what we think about as what's called like sleep hygiene or sleep behaviors. Okay, and we know that poor sleep or suboptimal sleep, even if it's not great, is itself a risk factor for worse memory and cognitive decline as we get older. Okay, and number 6 was lowering your stress. So stress is a concept we all have an intuitive understanding of, a feeling of being overwhelmed. And we all do things every day. We've developed habits to reduce our sense of stress. And that's really important. We know from a lot of research that people who endorse significant amounts of stress through middle age and on have increased risk of later life cognitive and memory difficulties. All right, and then the last piece, which is also sometimes neglected. So we talked about, let's see if I can remember them. We talked about diet, exercise, staying socially and mentally fit, building your cognitive reserve or the protective factors in the brain, protective factors that protect the brain from decline, lowering your stress level, and the last one is maintaining overall health. So, many people in their 60s, 70s, 80s have some chronic medical conditions, the high blood pressure, cholesterol, high cholesterol, mood changes, autoimmune problems, arthritis, things like that. And it does make it, and some people are more fortunate and have less conditions than others. And it does make a difference actually to have those conditions controlled. So if someone, and a good example is if someone has uncontrolled blood pressure, for, they've tried medications and exercise and various other things. That itself is bad for the blood vessels that go to the brain and increases the risk of later life decline and memory decline. Another easy example to think about is take something like type 2 diabetes. So diabetes is a controllable problem, but uncontrolled diabetes itself is an independent risk factor for dementia or decline. So if you control for other factors and you have two different people, and let's say they both have diabetes and one has less controlled diabetes, their thinking and their memory function is worse over time than the person who has controlled diabetes. So the main point there is that keeping up with overall medical health, medical problems and general well-being and health are really important. So with that, I wanted to give a framework, and I really encourage people to ask questions, and I want to make this a space where whatever is on your mind, share and ask. I think that's the most beneficial for forums like this. So maybe I'll turn it over to Nancy or Ilana and sort of ask what makes sense to next to do.
Sure, Dr. Gill. If you just want to chat your questions to me, that's fine. If you're feeling not shy, feel free to just go ahead and ask Dr. Gill. But I have a few questions. Questions about recreational marijuana and also Prevagen and how that impacts memory.
Good questions. So I think the jury is out on recreational marijuana, on cannabis, and what I mean is there's a lot of good research going on for using cannabis for medical and specifically neurological or brain conditions, and those are all promising. And in fact, for example, for seizures in epilepsy, cannabis derivatives are part of prescription meds, and they're being used to treat seizures. I think that, and then the other medical piece of that is that if you take something like Alzheimer's disease, there's emerging research that depression and agitation and some of the behavioral symptoms that we see with dementia, with Alzheimer's, can be well treated with cannabis. So those are all promising. I think the jury is really out on the benefits for cannabis, related to normal cognitive aging. I think you can make an argument that it certainly reduces stress for many people, and as I mentioned, reduction of sense of stress is a protective factor from decline. So that's how I would see it. The other question about Prevagen, who has heard of this supplement Prevagen? Can I see a show of hands for who's okay? So Prevagen is a well-marketed and hyped supplement. And if you notice in the messaging for Prevagen, I think it's advertised as the #1 memory supplement, is how they describe it. And there's very specific reasons for that, because supplements and manufacturers of supplements can't make declarations like this is good for dementia prevention or Alzheimer's prevention, or this is good for treating cognitive impairment, okay? Because there hasn't been randomized clinical trials, like the kind of studies that, approved the COVID vaccines, for example. For people that may be familiar with that, there is a way to understand interventions and medications in modern medicine, which is examining them in a controlled way. For Prevagen, the last I looked, there was one study which had some flaws of design in my mind, and it really showed really marginal differences between the group that got Prevagen and the group that got the placebo. And so I think I can't endorse it, frankly. I think from a pure experimental perspective, I think it's harmless. I think if somebody wanted to try and see if it helped them, that would be reasonable, but they shouldn't have any expectation that this is something they need to stay on because that's what the commercial says you should do. Um, I'm happy to, does anybody have any thoughts or other reactions to supplements or to Prevagen in particular, or questions that come to mind? Or
I have a question, Dr. Gale. Someone's asking, how important is exercise really?
That's a great question. So I think that exercise is the most important of these 7. If you want to
That's what
think
I
about,
heard once.
yeah, say it again. Oh, so I think that, and I think the long-term studies of patients supports this as well, that getting regular aerobic exercise, so that means that you're a little bit breathless, doesn't have to be vigorous, moderate exercise, but at least light aerobic exercise where your heart rate is up a little bit if you check your pulse, and or you're slightly out of breath. You know, the recommendations, if you look at the exercise recommendations for people 60 and above from like the World Health Organization, for example, it's 150 minutes a week of aerobic exercise. So now that's 3 50-minute sessions. If I have that right. I don't, but it's 150 minutes total a week. So if you split that up, you can imagine short segments of, you know, it's not that much if you split it up. But anyway, that's the general recommendation. I can just tell you from my experience that there are people who I've seen in my practice, and I think in our general neurology practice, who haven't done exercise that regularly, but start a light or moderate exercise regimen. They initially came with some cognitive complaints or cognitive difficulties, and they really stabilize over time, you know, sometimes years, sometimes months, but it's beneficial anyway. So I that's my long answer for, I think exercise is probably one of the most important of those recommendations.
Are there certain foods that are more important than others to improve your brain health? I know sugar and fat is probably detrimental, but what might improve it?
That's a great question. The way I would think about that is that general diets, if you think about a bunch of components of a diet, are more protective against there being decline, as opposed to me saying this food or that food can help improve your memory. So, and the way to think about it, and if you look in the packet, there's a description about, I mentioned the Mediterranean diet or the Mediterranean style diet, and this other diet called the MIND diet. So these diets are high in fresh fruits and vegetables, high in lean sources of protein like beans, legumes, fish, soy or tofu, okay, these types of things. Whole grains is a bit sometimes controversial in these diets, but they're certainly better than distorted grains or white grains where there's been something that's done to the grain. So if people are interested in more, there is a great book actually to think about that's called The Mind Diet, M-I-N-D. And the author's last name is Moon, M-O-O-N, like the moon in the sky, Maggie Moon. It's just one of several different books out there on the mind diet. So that's how I would think about it. It is interesting to think about if you're having no problems with memory at all or very minimal problems, you know, is there anything you can eat or take that boosts your memory above just preventing decline? I think, you know, people talk about things like the stimulant medications that might be used for attention deficit disorder or those types of things. I think that's less of a prudent way to think about it than to think about what is the diet you should generally take to maintain your brain health kind of where it is.
Okay, thank you.
Sure.
Do you have any thoughts about audiobooks versus reading, if one might be better than the other?
No, I think the research would support that they're comparable and it's hard to distinguish between those two. I think if you're talking about, we can think about it a different way too. If someone is struggling with reading or keeping up with it in the same way that they were before, you know, they come back to a novel that they're reading and they're forgetting like salient details of the novel or that sort of thing, and they want an activity to continue to brain stimulation, it absolutely is kind of just as good, if you will, to stick with audiobooks. You know, but I really try to not differentiate, you know, one activity versus another, because I just don't think there's enough research to substantiate and say like this is better than that. One thing I'll just mention that came to mind is that hearing difficulty or hearing loss in general, this has been emerging in the last year or two with a bunch of large studies, itself is a risk factor for cognitive impairment or dementia. The brain is getting less stimulation to the auditory cortex, probably, we think, and because of that, there's less protection of decline. So it's important, generally speaking, if someone is having hearing difficulties, to do what you can to treat it, hearing aids or other interventions.
Gail, go ahead.
I did see a hand raised.
Okay, can you hear me now?
Yes.
Okay, so my question is, at the beginning, you talked about some common signs of aging, forgetting things, forgetting names. I guess my question is, that's like the beginning of just regular senior moments. What is the stage when you should become a little bit concerned that it's more than a senior moment? Forgetting names consistently.
Yeah. I think that's an important question. I think the degree of difficulty that the problem may be causing in your daily activities, if it's hinting at a disruption of daily functioning. So you can imagine a situation where you're experiencing short-term memory difficulty or word finding difficulty. But if I were to videotape your life, you know, 6 months ago and today, there's no difference in your functioning. You're compensating or something for it, right? You're really, you know, you're aware. So this is one distinction. Whether it's consistent or not, you know, if there's a period of 6 months, let's say, where you think back and your family members say this too, that it was happening occasionally and now it's frequently, it's every day that you're having this symptom, you know. But I want to, as I'm saying this, I want to step back and say this. I think the open conversation about this with family members, with primary care doctors, you know, with anyone you interface with in the health system is really the key. Because, for example, in the annual Medicare wellness visit that people have, you know, you're supposed to have a basic memory screen done, like a cognitive screen done. Now, we know that something like only a quarter of those annual wellness visits have a cognitive screen, just because of, you know, primary care doctors have a list of 100 things they have to do during that exam. That's just an example of, you know, if you were in that circumstance, you could say, listen, you know, I don't know what's going on. I mean, I'm noticing that I'm somewhat forgetful. I think it's probably normal aging. There are screening tests that the health system can do to help with that reassurance. Out of curiosity, who had any kind of memory testing at an annual visit with their doctor, like primary care or internist? Can I see a show of hands? Okay, that's good. That's, I mean, that's a couple. Yeah. So, and just to finish that point, it's a complex question because sometimes frequent memory loss indicates a problem, like a medical neurologic problem. Sometimes it's normal aging. And there are ways, easy ways to follow that, to monitor it, and to help figure it out. And sometimes engaging with, you know, your doctor or a specialist like myself, a neurologist is the way to go. But it's not easy sometimes. It's true.
I have a question about the best avenue for pursuing professional help for sleep problems.
That's a great question. Of course, there's a medical specialty of sleep medicine, and it's usually done by neurologists or pulmonologists. In this region, it's mostly neurologists that do sleep medicine. And so what do? They hear what's going on with you. I'm having difficulty falling asleep or staying asleep. What medical problems could be contributing to that? What psychological or psychiatric problems could be contributing to that, if any? Are there any medications you're taking? That sort of thing. So a review of your sleep complaints. I think this is what the person is asking about professional help, meaning what medical help. Now, interestingly, you follow a pathway where there's you can have what's called like a sleep study, where you have your sleep is observed overnight with various measurements being taken. Then people have heard of like conditions like sleep apnea, where you have difficulty breathing at night while sleeping, for example. So that's kind of the medical realm, where there's tests to be done to determine if there's a medical sleep problem. The other thing that just quickly comes to mind is that for insomnia that's not caused by a medical condition or because of medications or things, there are a lot of psychologists who can do certain type of sessions or therapies like cognitive and behavioral therapy for sleep difficulties or for insomnia. And I think that's a really underappreciated resource in the community, that there are counselors and therapists that really have an interest and a focus on sleep that people could utilize more. One resource that just comes to mind for that is there's a great website called psychologytoday.com. It sounds kind of funny to say it's a .com. Actually, it might be .org as soon as I say that. I think we can check, but it's either psychologytoday.com or .org that actually allows you to search for the problem you're having. Let's say it's sleep or anxiety or depression, and you can search in your region. You can put in a zip code from where you live, and it will populate a list of providers in the area, psychologists, social workers, to give you a sense of who lists that problem as an expertise of theirs or as an interest of theirs. And that's a way to connect. This way you can be in the driver's seat. Thank you. It is psychologytoday.com. This way you can be in the driver's seat about, maybe putting out a couple phone calls to people who you might want to see. There's usually a bio of the therapist or the counselor, and a description of what they do and where they practice and things like that. I see a question in the chat about, does sleeping in a room while the TV on bad? So it can be. I mean, a lot of people get used to the noise, for example, of white noise or TV, or some people do this, and this is what helps them to fall asleep. What I would challenge someone who's in that situation to do is to slowly try to remove that external stimulus in order to see and to prove to themselves, what happens when they take away the noise, and whether they feel that their sleep is better or their ability to fall asleep is better. That's not easy if you're used to it. But generally speaking, I think people would agree that you want to try to fall asleep in a setting where you're not getting a lot of external stimuli like sound or visual, like I mentioned, if you're looking at, there's a lot of new studies on the bright screens on devices, like kind of lighting up your retina right before you try to close your eyes to go to sleep. that's an example of stimulation of the brain in a setting that you don't want to be stimulated. What else is on anyone's mind? This is I really want this to be an open forum for questions. Is there anything? Now's the time. We're friendly. We're all friendly here.
Could you address having relaxing music or meditation type music to fall asleep?
I think that's a great question. I can tell you that there's great and emerging evidence on mindfulness practices and meditation as being healthy behaviors for the brain, for sure, just generally speaking. In fact, there are certain interventions, certain particular regimens of mindfulness practice that have been studied for cognitive impairment. So for people who already have some early, let's say Alzheimer's disease, but they're functioning very highly, there are certain interventions which can stabilize their decline for some periods of time. And those are mindfulness-based practices. I think I'm not opposed to and I don't think the research would also be opposed to stimulating some kind of relaxing music prior to sleep. In my mind, it's a balance between reducing any stress or anxiety related to sleep and then having the extra stimulation. I think if one senses that this is a way they fall asleep by listening to music, it feels like a healthy habit, and they try periods of time where they don't have relaxing music and they have more stress, then clearly the benefits outweigh the risks. If you were starting from scratch and said, I want a certain method to help me relax more in the evening, I'd say try something like a mindfulness-based relaxation activity as opposed to music or that kind of thing. Someone put in the chat, how about the exposure to light given off? Yeah, the idea there is that in order to have the brain get into a sleep state, which actually relates to the question about melatonin as well, you want to mimic what the light patterns are if you were outside, camping and it starts to get dark and the body and the brain get ready for bed, for sleep. There isn't a lot of external light. So there's not a lamp in the room, you're kind of with nature and you're going to sleep when the sun goes down. That's the way that I think about the variation of light as far as sleep, and there's people who know 100 times more than I do about this. But generally speaking, you want to reduce extra light in the period leading up to sleep in order to not have an unnatural stimulus of light that is you wouldn't normally have as our species, where we're kind of artificially in these buildings with a bunch of light. Somebody asked about, do you recommend using melatonin? Melatonin is a natural hormone in the brain that has fluctuating levels naturally based on our sleep state. And for neurologic conditions, generally I find, and I think others find, that melatonin is very helpful for regulating sleep patterns. So if people have disrupted sleep, like with Alzheimer's disease, having disrupted sleep is very common, and melatonin can often be very helpful to try to regulate that. I think if someone was having sleep difficulties without a neurologic problem, I would try to start with something like I mentioned, mindfulness-based relaxation practices, even cognitive and behavioral therapy or CBT, that's done maybe with a counselor or a therapist. Somebody asked about how concerning is it if one has a family history of dementia and Alzheimer's. So one of the the biggest risk factors for Alzheimer's disease are, it's interesting, age alone is the biggest risk factor for Alzheimer's disease. So no matter what one's family history is, for all of us, every decade of life that we live, we have an increased risk of developing dementia, Alzheimer's disease. So this is why it's more, there are people who live into their 90s and 100s who have very, very little memory difficulty, but they still have this risk of decline. And interestingly, if you look at the brains of people in their 90s and 100s who are very cognitively normal, so many of them have early plaques and tangles that we see with Alzheimer's, but they are resisting those pathologic changes in the brain. In other words, they're pushing through and compensating for what would have normally been an age-related decline. So that's one of the biggest risk factors is age. Genetics, or it running in the family, so having a family history, is definitely a risk factor for Alzheimer's disease. You might be 2 times more at risk. Doesn't mean you will get Alzheimer's disease if you have a family history, but your risk is maybe 2 times higher than someone else who does not have a family history. There's a rare, less common type of Alzheimer's that people may have heard about, like familial Alzheimer's disease, which is often early onset, people in their 40s sometimes or 50s who have clear progressive memory decline. That is different than 99% of dementia and Alzheimer's in this way. For those families, there is sometimes a gene that they have that you can test for, just like Huntington's disease is a common condition that people know about, has a heritability of 50% to pass on. There are rare families in which there's a testable gene. But when I say that Alzheimer's runs in families for the other 99%, it's usually that there are a couple of members, maybe 1 or 2 in the family at different generations who had Alzheimer's. And so there's an increased risk, but it's not a 50% heritability risk. It's not deterministic that they will get the disease. So to answer the question very shortly, it is more concerning. The risk is higher if you have a family history. And that's all the more reason to take part in these brain healthy behaviors, which are good for all people, no matter whether they have a family history or not.
Gail?
Yes.
I've been diagnosed with severe sleep apnea about 3 or 4 months ago on a home study.
Okay.
I have not been able to adapt to using the mask that they recommend that I use. I mean, in the long picture, do people die from sleep apnea? I mean, what would happen if I just stopped using the mask?
So sleep apnea and severe sleep apnea itself is a risk factor for stroke. It's a risk factor for heart attack or heart disease, and it's a risk factor for dementias. So there's a couple components to your question. So the first is, you're not alone. There are many, many people who have trouble tolerating this CPAP or continuous pressure mask, okay? And the field, medicine, just needs more people working on better interventions for sleep apnea, because I don't know what the rates are, but the rates of non-adherence to that mask are very high. So you're not alone. And there are alternatives, like certain positioning in bed where you can force yourself there's some very old school techniques that people use where they sew a tennis ball or something in the back of a shirt. I don't know if people have heard about this, but it forces you not to lie on your back, but actually on your side. So that's a little better than not wearing the mask at all. And then there are other interventions, like a dentist can fit a bite plate for you where it will open up the back of the pharynx a little bit more in the back of the throat. Again, you know, the best evidence is probably with using CPAP, but which is the mask. But if you can't do that, then you know, there's these other things. But I wish I had a better answer than that. It's something worth talking to the sleep doctor or your primary care doctor about. You know, like, are there other things if I can't tolerate the mask? There's also masks that have a nasal cannula where it's pushing air through the nose as opposed to totally over the face. You should also ask them about general fittings. There are different fittings that are better and models. Somebody asked, did you use Alzheimer's and dementia interchangeably? So if I may have, and I was doing that first as a shortcut. And so dementia is the umbrella term that we use to describe loss of daily functioning due to memory loss. So I'll say that again. If you use the word dementia, you're describing the condition that someone has where they have some difficulty with daily functioning because of short-term memory or thinking difficulties. It's the analogy I use is it's like saying fever. If you said, I think you have fever, if a doctor said that, that would be a description. It doesn't tell you what the cause of the fever is, right? You would want to ask, okay, you tell me that I have fever. Is it because I have a urinary tract infection or a pneumonia or, you know, bloodstream infection? What's the cause of my fever? Dementia, you can think about similarly as that. The word dementia is a description that you would use to say this person has a loss of some degree of daily functioning due to difficulty with mental sharpness or acuity. The most common cause of dementia, when you look under the microscope in the brain, is Alzheimer's disease. So about 85% maybe or more of later life dementia is caused by Alzheimer's disease. The other causes of dementia are things like Parkinson's disease causes dementia, not in everyone, but in some patients. There's a disease called dementia with Lewy bodies, which people may have heard of, like Robin Williams had this disease, the actor Robin Williams. There's a disease called frontotemporal dementia or frontotemporal lobar degeneration. That's another type of dementia. So when people, you know, it's okay when people use it interchangeably, usually they're correct because most dementia, the umbrella term dementia, is caused by Alzheimer's, but not all. So that's, hopefully that answers that question. Somebody asked, can you define mindfulness? So mindfulness, and I'll take a shot at it. Mindfulness is a practice, an intentional practice, a deliberate practice we can all do, where we cultivate a sense of awareness to our thoughts and our feelings, what we're experiencing. The practice has a lot of roots in Eastern traditions of meditation, for example, but it can be done in a very secular and practical way to improve one's mental well-being, if you will. So there's many different books and resources about mindfulness out there. One of my favorites is a very basic introductory book called Mindfulness for Beginners. It's by a psychologist named Jon Kabat-Zinn. People may have heard of this book or this author. The last name is Kabat, K-A-B-A-T-Zinn, Z-I-N-N, who's really one of the fathers of the medical use of mindfulness. He and colleagues at UMass came up with a program called Mindfulness-Based Stress Reduction, or MBSR, as an actual program, like a protocol that can be done for cultivating mindfulness. But there's a lot more to say about that. It's such a useful tool, I think, for all of us and for hopefully all of the world ultimately, to try to improve mental well-being, relationships, and a lot of other factors. I'm a big fan. All right, ginkgo biloba, I can just answer that. So ginkgo has interesting studies that suggest some benefit for early Alzheimer's disease. It certainly does not have the evidence for treatment for early Alzheimer's. It certainly doesn't have the type of evidence that if you look at the guidelines for treatment in our professional society, if you look at the neurologists, guidelines for treatment, no one is like prescribing ginkgo biloba yet. Maybe they will, but not yet. But if you look at the individual studies, there's definitely some hint of a benefit. I don't know much about ginkgo or ginseng as another example, as far as just maintaining normal cognitive aging and protecting and reducing the risk of dementia. But it's interesting. I mean, for ginseng, like a fifth of the population of the world takes supplements like ginseng. That probably needs to be studied more. But generally, I'll give you quickly, my view about supplements is that most of them are possibly beneficial, mostly, almost all harmless. And the way to think about it is if you wanted to do an individual trial for yourself of not changing much about your daily behavior, your diet, but adding something like a ginseng supplement, that would be reasonable to do. I mean, I may not tell you that in my medical practice because I'm trying to give you the science-based, evidence, but from a standpoint of, the industry of supplements, a lot of people are using supplements outside of the health system. And so I would say it's reasonable to try and then determine, do you feel more mentally sharp? And, does your family observe that's the case? I'm just telling you my experience from a lot of these conversations with patients in the office and everything. But there is no consensus scientific evidence that there's any supplement that really changes the course of normal cognitive aging. The things that do that are aerobic exercise, mental and socially stimulating activities, and healthy eating, Mediterranean style or MIND diet. Those three have a bunch of evidence for maintaining cognitive sharpness and reducing decline. Let's see. I know that we're backing up on a time of maybe close to 3. Maybe we can, Ilana, go until 3, 5 more minutes or so. Is that reasonable?
Your schedule is by far the busiest, I'm sure, of any of us, Dr. Gill.
Okay. Well, I'll just say maybe we can do that. And then if people have follow-up questions or what have you, hopefully some of them also will be answered in the video and the handout. Someone's writing in the chat about kind of a dig at supplements. Yeah, I think the supplements question is really interesting because I want to say $1 billion industry of nutritional supplements, and then people have a lot of thoughts and views about them. I think there is a lot of hype. The supplements are certainly not regulated by the FDA, for example. The quality even of things like melatonin, or vitamin B or vitamin E are not clear. Having said that, I mean, generally, patients that have a vitamin B deficiency, let's say, that come to my practice, like I have them take a vitamin B12 supplement, and I'm not checking the manufacturer per se. So, I mean, generally, I think these things are harmless, but I'm giving you a sense that supplements are not very regulated. They're certainly not, most of them have not been studied in a randomized clinical trial, like the way that the COVID vaccine was shown to be effective and stuff. So I agree with this point that you have to kind of take it with a grain of salt. You have to say, if I'm interested in this supplement, I read some about it, my friend says it works great, it's 99% of the time reasonable and healthy to try, just understanding the expectations of it, not thinking that it's going to be the panacea for reducing dementia risk, but seeing how you feel on it is the way to go. Any last questions, thoughts, or comments? I really appreciate the questions. I hope people have gotten something out of the discussion here. Anything else people can think of?
There's a great question I got. You mentioned 15 to 20 years before symptoms of dementia appear, there is the brain disease already present. Is that true? How do you know that?
So that is true. So for people who are going to develop Alzheimer's, for many of them, you can detect the early changes in the brain, usually by spinal fluid, by doing a lumbar puncture. That is, you put a needle into the small part of the back and you remove fluid. We know that that can be done. Now, that is not part of practice. And there's also, similarly, we're learning that detection by blood tests can help to detect the early changes of Alzheimer's, maybe 10 plus years prior to symptoms. In research, we are doing studies at the Brigham and other places globally where we enroll people, and I'll put this out there, is if people are interested in learning more about this, you can contact, one second. We can definitely follow up with Nancy Kopelman, who's on the line, and with Ilana to get you more information about participating. In research, we are looking at, enrolling people who are, say, age 50, 55 and up, who may have a family history, and we are doing tests like this, blood tests, spinal fluid tests, to try to detect very early changes prior to any memory decline. And that's a very promising and emerging way to detect things early and to try to intervene, but it's still in the realm of research. I hope that in the coming years, there will be more screening that happens from a health system level to try to identify these things. So that's my answer. But yes, it's very interesting, and there's much more to say about the research and work being done with early detection.
Dr. Gale, thank
Yes.
you very much for taking time out to share with us. I'm going to go out the door now and go for a long walk. I'm going to buy my vegetables. Back home, I'm going to meditate before the Celtic game.
I love it. I love it. I changed one behavior. No, that's great. No, thank you very much. And I appreciate the discussion, and thank you for the notes in the chat. Hope this was helpful. And as I said, especially for research participation, if people are interested in learning more, there are ways to be involved in research that are not very intensive. They could be 1 or 2 visits a year to, a center like Brigham or Mass General, where you're just agreeing to have a brain scan done and answer some memory questions, and it's very helpful. It's engaging for you as a participant. It also helps advance knowledge. So there's that kind of involvement. And then there's drug, studies and other things. So if you're at all interested, I will say this: we need thousands of volunteers around the world, to give their time. So if you have some time and willing and interested, follow up. I know Nancy, who's on, can be a good conduit for getting you involved. All right, take care, everybody.
Thank you.
Thank you very much.
Welcome.
You.
Bye-bye.
To give Nancy Kopelman's information, please.
Thank you, Dr. Gale. I want to just let you know that if you have interest in research, definitely feel free to email me. I know you all have my email address, and I can forward the email onto Nancy. I'd be happy to do that for you. So Nancy, any closing statements from you? I want to thank you for putting together this 4-part presentation.
I just
first
want
of
to
all.
say you guys have been amazing, and thank you so much for rolling out our roadmap series in the community. Newton is our first community to do this. We had done it, here at the hospital last summer virtually, and now we're starting to share this with the community. And I also like the fact that all of your people were so interested in doing something that was more interactive and asking questions and kind of seeing the presentation beforehand and then having follow-up. So it was very dynamic. And if anybody's interested in learning more about research or has additional follow-up questions to any of the sessions, please feel free to be in touch.
Thank you, Nancy. Yeah, I'm biased. I think we have the best participants in the world.
You're a great participant.
But thank you. You put on fabulous programs for us. So
Good.
thank you. We really appreciate it. And
You're very
we will hope
welcome.
to have you back soon.
Great. I hope so too. All right. Thank you very much.
Bye,
Bye-bye. Take
everybody.
care, everyone. Be well.
You.
All right. Bye.
Thank you.
You're welcome.